gorgeous day in Southern California at ACC 2015. You're looking at San Diego, and then you're going to be looking at John Rogers, who is an MD and cardiologist at Scripps Green Hospital in La Jolla. We're talking about a new real-world study of patients who have had a cryptogenic stroke and received an implantable cardiac monitor to detect AF. So this is Crystal AF study. The publication originally was in the New England Journal in 2014, and then there's some new data we'll talk about too. Tell us about Crystal AF first.
Well, Crystal AF was the largest study of its kind to look at the cryptogenic stroke population, to actually even better define that population after a very rigorous exclusion-inclusion criteria application. So for the first time, there was a rigid criteria to determine what was actually considered cryptogenic stroke. That population of patients, which is about 25, maybe 30% of all ischemic strokes, have no idea why they've had a stroke. So those patients will come in, go through a large workup, and leave the hospital with no reason as to why they've had their stroke. So this population was very well defined and then had an implantable cardiac monitor loop recorder device inserted in them and followed them for 3 years. The questions to be answered were, is there a higher incidence of AFib, atrial fibrillation in these patients? Was the implantable cardiac monitor superior in finding that atrial fibrillation when compared to what a physician might consider standard monitoring workup? And if atrial fibrillation was found, was the behavior changed as far as how those patients were treated? Right. Were they put on anticoagulation? Were they not, basically? And so that study at 6 months showed that about 8.5% of patients actually were found to have atrial fibrillation, which was significantly higher than standard monitoring. And by 3 years, looking at that same population, following them that far out, about 30% of patients were found to have atrial fibrillation, and then that's presumed to have been the cause of their stroke. Right. And most of those patients, over 95, 99% of those patients were placed on anticoagulation. So the implantable cardiac monitor strategy of continuous long-term monitoring was found to be superior than standard monitoring techniques.
Now this is a really tiny device that we're talking about.
That's correct. The Crystal AF actually was a study performed on the previous generation of the Reveal XT implantable cardiac monitor. Was about the size of a thumb drive. The current Reveal Link monitor is about 87% smaller, about the third of the size of a AAA battery. This is much more acceptable for patients, a much simpler insertion procedure for them to go through, generally requiring local anesthetic only, no sedation, usually just a few minutes and the patient is allowed to go home. So it's in addition to being an easier experience or less invasive experience for our patients, it also, this monitor, even though smaller, is capable of continuous monitoring and automatic downloads to us as the physicians. So we no longer have to wait for the patient to transmit monthly or weekly or whatever intervals we decide. We will get a transmission on a daily basis from this monitor automatically, with the patients really having to do not much else.
How much effort does it take in the office in order to go through this data? We're so swamped with data in offices these days.
Well, the monitor does provide daily information. If there's no arrhythmias identified, we're not swamped with any data on that day. If a patient should have an arrhythmia, we're then notified of that arrhythmia because of the small size of this device and the ability of it to one-way transmit to a bedside monitor, which then sends the information to us. If there's more than one arrhythmia in the course of that 24 hours, we may have to call our patient and say, can you send us a manual transmission to then get the rest of that data? But again, if there's nothing that's occurred in that 24 hours, we won't get any data sent to us.
Excellent. Now, very recently, the New England Journal article was very recent, that was February, but now just a few weeks ago at the International Stroke meeting, you had a presentation also. What data were presented there?
So this was what we call a real-world study of looking at cryptogenic stroke patients. And really what that was, looking at over 1,200 patients in a link monitor database where we followed patients who had had this device implanted for cryptogenic stroke, who may have not necessarily gone through that rigorous criteria. These were patients who had just been labeled as cryptogenic stroke, didn't have to go through the same gauntlet of tests and things that the Crystal AF patients had to go through.
Right.
But let's just look at real world, look at the data, and as it turns out, at the 6-month point in time, over 12% of those patients were found to have atrial fibrillation just at 6 months compared to the 8.4% of patients in Crystal AF. So in that real world population, we were able to identify 37% more patients than Crystal AF was able to, monitoring patients with the Link monitor. A lot of that had to do with that selection. These patients were unselected, just diagnosed with cryptogenic stroke, whereas the Crystal AF patients were very selected after a rigorous workup to exclude other reasons for their stroke.
I mean, you would think that in a really selected population, you might find more, but in this case, a general crowd, this device did really well in determining that there's a problem.
Yes, it did. This device did really well in determining in a general population of cryptogenic stroke patients that atrial fibrillation was present in more of those.
And this was presented in Nashville at the International Stroke Conference.
Just last month at the International Stroke Conference in Nashville, yes.
Is it going to be published soon?
I think as those patients are followed further, there'll be more publications that will come out from this, yes.
And we do have the citation for you from the New England Journal of Medicine, so please look at that. That's coming up right after I say. I'm Rick McGuire, Executive Editor, CardioSource World News.